As a respiratory therapist, you have the ability to change someone's life and change the life of so many patients every single day. A lot of what you're going to do is breathing treatments, suctioning, working with the pulmonologist on the trach care, on the vent weaning. That is a really large focus for us. We are really proud of our success rate, being able to get patients off of vents while they're with us. We have a higher success rate than most other hospitals. Ventilators are what keeps the patients breathing manually, so we're doing our best as a respiratory team to get these patients off of them to be able to breathe on their own. That is obviously a huge step in their recovery.
I realized early in my career that I loved science, and respiratory therapy was fantastic. There were tons of calculations that you had to do in your head on the fly with ventilators based upon what you saw from the patient in front of you. It's exciting. Even though you kind of know what you're going to do that day, you never know what you're going to do that day. So it makes each day interesting.
From room to room, you have different circumstances where each room is unique. So to troubleshoot in real time, the best thing as you're going from room to room, family to family, is challenging, but it is extremely rewarding. That takes a certain skilled team to really do well.
We really want someone compassionate. I would say that is a huge driving factor in everyone that we hire. That's part of our mission statement. So someone who's compassionate, someone who's understanding, detail-oriented, communicative. Again, you have a lot of people that you're working with, and then a lot of people you're working to support. So strong communication skills, someone who is really passionate and really dedicated to finding those positive outcomes.
We get to serve patients, families, colleagues, the people we work beside. We get to serve. So to be able to see somebody come in at a very sick point and then leave, walking like out the door with family is really awesome and unique.
I love seeing the patients smile. There's a look that patients have. There's a look that they have when they come in the door, and it's defeated, it's discouraged, almost depressed, and then there's a look on their face when they're ready to discharge to home. And it is a complete different affect.
You are an integral part of getting patients breathing, walking, talking, and back to as normal a day-to-day as possible. That is an impact that I think is really hard to make otherwise.